The views and opinions expressed on the following program are not necessarily those of the staff and management of Salem Media of Hawaii.
Aloha, this is Bianca, your host for Be Fit for Health. Thank you for joining me today. We're going to have an incredible show. I was very lucky. I had some connections with a fellow trainer who has a client who's someone very exceptional in the University of Hawaii. She is a professor, a counselor, and she's got a PhD, and she's a professor of tropical medicine and medical microbiology and pharmacology, but she's also I can't even say this, virologist. God help me with my speech. She actually has been studying viruses for about 50 years. And, you know, you don't get it any better than that when it comes to someone understanding the makeup of a virus and microbes. And, I'm really blessed to have her here today, and we'll be speaking with her in a little bit. But before I bring her on, I wanted to kind of talk a little bit about, our topic tonight, regarding the virus. Do we really understand what they are and how we can avoid them? And I was thinking about our lifestyles, and I was listening to another medical doctor talking on TV regarding our ability to control a lot of things that could happen to our bodies. And our lifestyle is one of them. We can change a little bit about what we've been doing up until this point. If you've been living a certain lifestyle where you're eating a lot of fast foods, or you're just on the go and you're eating in your car, you're not really sitting down and enjoying your meal. There is something to be said about digestion and the way that you eat your food. And, if you're eating standing up, or if you're eating, walking and doing business, you're not really fully engaging in the digestive system. And that's kind of important for you to absorb nutrients, right, into your body. So your cells have that ability to protect itself against free radical damage. And that comes from a lot of oxidation from different things, from stress, internal stress, external stress. So, if you can change a little bit about your lifestyle after having this experience of being, quarantined for over a month, think about what you can do at this point. Because forget the past, that's done, right? What you've done, it's obviously set some damage into our system, eating those fast food preservatives and things like that. But today, you can change that. And how can you change that? Just change maybe 20% of your life, of what you're eating. Maybe take out something that's not so dominant in your diet. Maybe a sauce, or maybe some form of dairy. Cut out dairy, maybe, if you can do that. Maybe lower your fat intake. That's bad fat, not good fat, like avocados are good fats, right? Olive oil is good fats. But take out those, margarines, or, those oils that are just triglycerides that are really bad for your blood, that just clogs up your arteries. Think about things like that. Maybe also change your sleeping pattern. We talked about this in a previous show. In fact, today's show on TV was the medical doctor talking about sleep. We talked about it here. It really does make a difference in your body's ability to fight and combat any type of infections. And then again, your attitude, right? That's another thing that we can control. Change the way that you're looking at things so that the things that you look at change. That's one of my favorite quotes. And it's true, because if you change your perspective, the things that you're worried about that are bad or negative also becomes different in your eyes. And so you can actually combat maybe stresses in your life that you weren't able to before. And these types of things also help with your immune system. When I briefly spoken with Dr. Hinshaw, who's going to be on our show in a little bit, her biggest thing to me, which I took away, was she goes, laughter is a big thing, and here she is, she's a specialist in understanding viruses and microbes and diseases. And she's telling me the more you laugh, the better, because it just produces good stuff in our system. If I was to just break it down in layman's term, it just makes your body healthier. And I believe in that. So, with that being said, I think, we should really consider, these types of changes in our lives that might make a difference in the way that we feel. Also, it'll change the relationships we have with our family and friends, because our attitude's different. We're more lighter. We're eating better, so our energy is more abundant. You're giving your body the good stuff. And that's where I was taking away from today's show, as well as my conversation with the doctor. And These are things that I believe in, and these are things that I'm trying to educate all of you with. It's not like, incredibly new stuff, right, that I'm talking about, but these are just reminders to remind us that life is precious. Things can happen in an instant. And if you can control what you can control it, because this kind of stuff happens. It happened before in the past when we had the SARS and we had the Ebola and we had all these other things. It can happen again. So we need to be prepared, right? So if something like this happens again, our bodies are healthier so we can combat this type of a situation. And if we can fight these viruses and microbes in a better, healthier body, then the chances of us ending up in the hospital, getting a major issue from this disease or this type of virus infection is much less. So in the long run, let's take care of ourselves. Let's take care of our families. Let's take a look at what we can change, and do your best to do so. Another thing too is we have choices in everything that we do in our lives, and I was looking at also the diets of different countries. And when I saw some of the things that people were eating, I mean, I don't understand why. Why do you need to eat certain types of animals that aren't in our normal food chain? And I don't want to be judgmental or criticizing any culture or anything like that. That's not what I'm saying. It's just that when you're starting to eat things that are just absolutely disgusting animals that are just rodents, they're out in the streets, they're not controlled, and you're just picking them off the streets to eat them, and you're cooking them and eating them. Something like this will happen. A pandemic can occur from an animal, and it always has been. And she's going to talk about this when she comes on. She will discuss about how there's different levels of viruses, and some of them are from animal to humans, animal to animal, and then, that kind of a level of disease. And there are certain types of viruses that are just really bad, and they come from animals. So be very careful in the type of protein that you pick. I mean, in this country, we're lucky. Things are regulated. We do have FDA approving a lot of things. The CDC's involved. And so we have things that are there that are regulated for our, for our health benefits. So, but when you go outside the country and you are in another location where you're not familiar with the way they take care of their protein, yeah, I mean, you need to be careful. I mean, these things can occur, but yeah, let's change the way we do things. Yeah. I know a lot of us don't think about having a burger or going out there and having a fast, food here and there. But, if you're doing it all the time, guys, just remember your liver can only recognize certain types of foods. And if it doesn't recognize the foods you're consuming, it's not going to process it as energy. It's going to process it as stored fat, and it may stay in your body for a long time. So, that's my tidbit. But I like to bring on the expert if I can at some point. And if anything else, maybe we can take a break. And when we come back, we can see what we can do about getting the good doctor on the show. Because again, I'm not the expert, right? I'm just the host here, giving you guys the information that I can to educate you. All right, guys. So further ado, we'll be back, and we'll get with the doctor.
Free month of Netflix, free month of Hulu, free month of Honolulu Club. What? That's right. Sign up today at Honolulu Club, Hawaii's premier athletic, social, and business networking club. And they'll give you the month of May for free. Honolulu Club offers state-of-the-art fitness services with Honolulu's top trainers and amenities. It's time to get ready to look your best this summer. Log on to honoluluclub.com or call 585-9626 for more info. Honolulu Club, Hawaii's premier athletic, social, and business networking club. Sign up today.
Have you heard of microcurrent therapy? If you suffer from chronic pain, arthritis, sports injuries, ligament injuries, or migraines, the electroequiscope can help. This non-invasive treatment system is drug-free and shows no negative side effects. If you are seeking pain relief and want to boost your immune system, schedule a demonstration or consultation by calling Kelly, your microcurrent electrotoxologist, at 485-9697 or follow on Instagram at Kelly's Time. Make your appointment today.
And we're back. Yes. Okay. So let's get some advice from the good doctor. She is, like I said, she's got a PhD in so many areas and fields of science that I feel like I need to bow down and say we're not worthy because she's so smart and brilliant in her expertise. And I'm so blessed and I'm so grateful to have her on. Dr. Virginia Hinshaw is by far, probably one of the most, experienced in this field that I'll ever meet, on this island. And, we just are very grateful to have her here. Doctor, are you on?
Yes, I am.
Oh, yay. Thank you so much for coming on today and gracing us with your knowledge and your information. I mean, I'm just so excited to get started. I was kind of giving them a little bit of a teaser on who you are and your experience in this field. I know what I've been, and I talked a little bit the other day about this, and the thing I took away from you, which was something so simple that people don't understand, is, our attitude and our laughter, which can help us build our immune system so that we can combat such things, well, the majority of the time. And I thought that was really wonderful because it really comes down to the basics of our lifestyle, isn't it?
Oh, yes. And laughter is an important part of life and being socially connected to each other.
Yes. And that support is necessary too, because it does feed our soul. We do need that family and friends to keep us feeling loved. That love thing is also very important.
I'm a believer.
So I had a question for you. There's a lot of shows out there that talk about the coronavirus and the COVID-19, and that's great. But I want to understand what exactly is a virus.
Okay, well, viruses are microscopic infectious agents which require a living cell in order to make more of themselves. And a lot of times it's easier to distinguish between bacteria and viruses. Bacteria are much larger, of course, but they can make more of themselves just sitting on a tabletop, whereas viruses can't. They must enter and take over a cell's machinery and then use the cell to make what it needs to make more viruses. So that's a big distinction.
So bacteria is a live entity and the viruses are not?
Correct.
Okay, so how are viruses made?
The cells. The viruses enter the cells by various means, and then they have enzymes, and they have a genome, but it's limited. And so they take over the cell's machinery and use the cell to make what it wants. And it also stops what the cell normally makes for itself. So then the virus takes over and makes more viruses and puts them out into the environment.
So there's some form of intellect then with the virus. Is that what you're saying?
Well, it's impressive that a small, tiny bit of genome like this can do as much as it can. That is true. It's very powerful in many ways, but yet it cannot replicate or grow unless it gets into a living cell. And
a bacteria can live on its own, wherever it is, correct?
Right.
Wow, that's crazy.
Correct.
So they're saying with with this particular virus that's out there now that it was man-made because there's patents on it. Is there such a thing?
No, nature does this all the time. We see that a lot with influenza, where viruses get genes from other viruses or change and become more hazardous, more virulent. So Mother Nature, this occurs in Mother Nature. When we have a lot of viruses in other species, and then the species start mingling.
So they're kind of mutating then?
Yeah, they change. What it is the coronaviruses, which COVID-19 virus is a member of, it's a great big family of viruses. They have they're grouped together on, their structure, the type of DNA or RNA they have, how they replicate, who they infect, what they infect, and the type of disease they cause. So we organize them into families based on those criteria. Now, coronaviruses have 4 different groups, alpha, beta, gamma, delta, which do different things. And the beta coronaviruses are particularly important right now because COVID-19 virus, along with the ones that cause SARS and MERS, are all in that group. And so those are kind of the nasty members of that family.
So how do you guys regulate these? I mean, how do you categorize them based off of where they originate from or how they are spread? How does that work?
Well, usually you start with their structure, and they have certain different structures, different viruses do, and then whether they have RNA or DNA as their genome, and it can be single or double-stranded, and then actually how they undergo replication within the cell, because viruses use a lot of different approaches, and then what that type of host they infect and the type of disease. Those are usually the main criteria that we use to divide them into groups.
And the quickness to spreading as well, I guess, I would assume.
Well, the spreading has to do with whether the virus is going to be highly successful in continuing. That's more where we could look at, like in a pandemic, there are three characteristics you look for. One is the fact, is it a new virus for humans, which this one is, and because then we have no immunity to it. And the second one, does it cause serious disease? And clearly we're seeing that with 2,700,000 cases and over 190,000 deaths in the world. And then thirdly, does it spread easily person to person worldwide? And those are the ones that are involved in pandemics, and that spreading easily from person to person is a very important characteristic in causing a pandemic, which COVID-19 has done. So I'm
going to be probably asking silly questions because I know there's people have asked me these questions. I don't know what to say, but someone has said, and I think I said this to you before when I was talking to you on the phone. Well, the chicken pox and the measles were very contagious too. Well, what were they? Aren't they viral? Aren't they?
Yes.
Yeah. So I thought, how is this different than something like that?
Well, they're in totally different groups of types of viruses. Also, we have vaccines against those. And so that's a big difference here. Of course, we don't have vaccines or drugs at this point that we can use for the population.
Right.
But they're all different. The viruses are very creative in a way, and that these different groups of viruses have different features and they have different ways of spreading. Measles is probably one of the most highly contagious viruses.
Right. And I think we were talking about HIV too, and that was out there at some point, and we didn't have medication for that back then too, right, when it first came out?
Right, that was a pandemic, and thankfully we've made advances in there to reduce the disease problem with that one.
That one took a while though, didn't it, like 20 years or so?
Yeah, it's not fast a lot of times, and you got to remember one of the challenges with viruses, because they're using the cell's machinery, you have to be careful with what you do with drugs because it may mess up the cell just as much as the virus did. So antivirals, we don't have as many of those as we have of antibiotics for bacteria. And It's because of that difficulty is where can you block the virus? You're trying to figure out something that the virus does that the cell wouldn't normally do and block that step.
And you would have to have a very strong cellular function in order for you to be able to stop these viruses from launching onto or latching onto the cells, correct? Well,
usually the point of blocking a virus is created by antibodies. If you have a virus and you recover, you develop antibodies to it. And then the next time that virus comes around, the antibodies block the virus from attaching to your cellular receptors so it can't enter a lot of times. That's one of the main ways of controlling viral diseases.
So the people that didn't get the major symptoms, but they may have been tested positive, and then some people who are on their deathbed, I mean, what's their difference that their bodies, related to this virus so differently?
Well, that's a critically important question, and we don't have all the answers to that at this point. This virus is, certainly we understand with older people because they have other conditions that might predispose them to increased disease. But the fact that this virus is causing a lot of different effects in people, and some people don't show any, like you said, don't show any symptoms, and then some are deathly ill. That's really not clear at this point in time.
So the cellular anatomy doesn't give you guys an idea of how certain, viruses or bacteria can penetrate into the cell and destroy the DNA and the entire system in the cell versus, go ahead.
We know a lot about how it infects and replicates in cells, but you're talking about within a host, which there are a lot of other factors that go into play with the host, whether they're whether there is a genetic difference among people, whether their immune response is too low, too much. There are a lot of factors that go into that don't just depend on what we know about a virus replicating in a cell.
See, that's funny because it leads right into the next question that I had. Like, for preventative measures, I've talked about so many different things on the show: sleep, food, working out, exercising. But then if you have something that's chronic, let's say I was just talking before you came on, you've been eating junk food majority of your life, and your body doesn't know how to absorb the nutrients because it doesn't recognize what you're eating because it's preservatives and things like that. What do you do with someone like that to help them, prevent the next round of infections like this?
Well, like you said, it's really important for us as individuals to get ample sleep, eat a healthy diet, exercise, and also stay connected with people.
I know that we were talking about also in another show, animals being very important in supporting someone's psychological and emotional levels, which also help with the immune system. They just recently found that 2 cats, house cats, got infected with the coronavirus from human to cat. Is this possible?
Yes. These viruses can infect different species, and you have a lot of people who have cats have close contact with them, so it is possible that a cat can pick it up from the human.
Crazy. That's scary too. Well, they're saying that there's not going to happen, that you can't transfer from the cat to the human on the news yesterday, and I thought that would be strange because we're all hosts, right? We all have cells, so why couldn't a cat give it to a human?
Well, it's a good question. I haven't seen the data that says why not. Probably it's because maybe the cat doesn't produce much virus. It'll vary depending on the host as to how much virus they produce. And so then it may be more difficult for it to transfer back to another human. But I haven't seen the data on that.
It's crazy that we don't have that much information regarding this new virus.
Well, we have a lot about members that are, their cousins. Coronavirus is great big family of viruses, and there are a lot of them around. In fact, a lot of coronaviruses cause infectious diseases in people, like mild colds, but they aren't a big health hazard because about 15 to 30% of all respiratory diseases in people each year that's caused by coronaviruses, but they're not this particular type of coronavirus. These are different.
I think it's because we don't have any type of a solution for it. It's where people are getting a little bit panicky, and the higher ups in the governments, they're just afraid that if people don't take it easy or quarantine themselves, they can't really protect them because we don't have any vaccines. We don't have any medications. So, this being so new, I get a lot of these questions, and I'm like, well, this is a new virus. We're trying to understand its anatomy, the way it works, and how it's going to change. It might change again. It might mutate again and do something different. We don't know. But it's always best to stay on the safe side of things.
Yes, there are a couple of drugs that look promising. Remdesivir, that's one that they're testing a lot because it was developed for a different viral infection. They're checking that. But you're quite correct. We do not have proven vaccines or drugs to combat this, and that's why we're really dependent on the more draconian measures that we're having to do, is the physical distancing, the quarantine of contacts, and strict hygiene. All those are very important because that's what we're left with when we don't have good control. And unfortunately, the U.S. started very late in testing. They ignored it for a good while. And so the virus got a foothold, and now it's certainly quite capable of spreading, as we can see.
Yeah, I think the Chinese held out on the information for a bit, and then we got wind of it, and I think it seemed like it was going to stay over there in China. And then, we kind of dismissed it and then realized that, no, this is spreading in different areas, and this is starting to become a bigger deal. And next thing you know, everyone's quarantined in their homes, and so much for, staying at work or even socializing with your family on special occasions. But, this is something that we need to do. I mean, luckily in Hawaii, though, not to dismiss any of the hardships that people have had, but we have just 600 plus people that got infected that we know of, but we've done over almost 30,000 tests so far.
Mm-hmm.
So it seems like we're controlling it pretty well here. I think closing the airport was a good idea to some degree because you don't want foreigners coming into the state. This is a tourist town. Then you're going to bring in more variances into the community, and just the social distancing that we did, I think, stopped it in its tracks. Because I think if we didn't do that, we would have a lot more. Because we have like 1 million people living here collectively, and then you have foreign people coming in. This would have been a disaster.
Well, one thing I'd like to emphasize is that, viruses don't need visas. They can just come on in wherever they want to go.
You're so funny.
It's really important that we keep ourselves and our next-door neighbors healthy, but also our global neighbors.
Yeah.
Because a lot of these viruses or other diseases have the ability to become global because of the way we live. And so people have to be cognizant. This is a time that requires great global cooperation if you're going to control a pandemic.
Yeah, information has to be shared, and it has to be uniform so that people are, following through with it. But the problem that we seem to be facing also is that, the lack of understanding from the public standpoint, because we're not, doctors or scientists or things like that. We don't understand why, but we just feel like we're being separated and isolated, and it's starting to become, and I'm seeing this on Facebook and social media, where people are starting to act out a little bit, and they're starting to panic a little bit on being, secluded. And it's kind of necessary until we really do flatten that curve to a point where we feel like we have control over this to some degree. I mean, because I don't think we're going to get the virus out anytime soon. I mean, the vaccine.
No, I don't either.
Yeah, the vaccine's not going to come out either because you have to test that for a while, right?
Right. That takes usually you're talking about a year to a year and a half from start to finish. And they're trying really hard. There's a lot of research clearly going on about the vaccines and the drugs right now to try to get a better handle and better protection. But right now, we are left with the fact that the best protection is that physical separation. And it is hard and it's challenging, and people are scared. That's normal. That's to be expected. But it's really important to stay calm and try to do your part to keep yourself and everybody around you healthy.
So how do you, let's get back to the body. I hear a lot about this thing called cytokines, and I know that we have that as one of the cells in our system, correct? What does that mean, the cytokine storm? I don't understand that exactly.
Okay, well, cytokines are proteins that our cells produce, our immune cells produce, and they do it normally. It's a good thing that they do it because they respond when we have an infection, and they release, and then that causes the body to respond more in a stronger immune response. So cytokines are not bad; they're good things.
Okay.
But what happens with certain viral diseases and certain other situations, people overproduce them. Their bodies start producing way too many, and cytokines in that situation will damage the body and damage the cells, and that's what they call a cytokine storm, when you have an overload or way too many cytokines circulating. And it's certainly damaging to the lungs with respiratory diseases. And actually in the pandemic of influenza in 1918, where about 20 to 40 million people died, one of the reasons they thought that young people died was because they had a cytokine storm, because younger people have more robust immune systems than older people.
Mm-hmm.
And so the cytokine storm is related to the fact that the virus is causing the body to overproduce, but it's dangerous. You get too many, it's like too much of a good thing.
Right.
And so it starts damaging the cells as well.
Well, that's kind of, is it almost like a overactive immune system then? Is it like your body is just overly sensitive at that point, that your body is just producing too many of the good stuff? Yes,
it's an overproduction, and there are cells that circulate in our body, macrophages in particular, that the virus can infect. It doesn't make virus in those cells, but it causes them to start putting out signals to make cytokines. And so because there are products of our own immune system, but when you get too many, it's not good.
And how do you combat that once you have an overabundance of that happening in your system?
Well, time will tell. Of course, certainly if you can control the virus, then the response would go down. Now, people have talked about using anti-inflammatories,
right.
but that's kind of a two-edged sword because you don't want to depress the immune system too much because it needs to do a lot of work in there to clear out the infection.
Right.
So it's not an easy one.
So I have a health question that I don't know if you can answer, but what about fasting? Does that help the body stop from working on the digestive tract, but now focusing more on the health factor of the body? Have you heard of the longer fastings, like water fasting, to help with stem cell stimulation, neuron recovery, maybe helping the cells do autophagy to detox, things like that?
Well, that's not an area that I have expertise in, but now water, people with viral diseases, you should hydrate. You shouldn't fast with water.
Right. And to get rid of all the toxins. Yeah. Yeah, and they're even saying that's important.
Areas I'm not familiar with.
Yeah, so they were saying that with fasting, because your body is so predominantly focuses on digestion when you eat, so that's what it does mostly. That's what they work towards, right? Because you need the nutrients. But when you stop eating for a period of time, and I did a timeline on the show before, it was at 12 hours you get growth hormone stimulation, and then you get ketones activated, which helps with T cell strengthening, and then it goes into autophagy for as long as you fast, and then it also gets into stem cell, stimulates stem cell, and all sorts of other good stuff. Inflammation goes down after 24 hours of fasting, and there's a lot of medical journals written on this regarding fasting and what it does. And this is pure water fasting, so you can have black coffee in the morning, but you can't have anything that might stimulate your pancreas to think their insulin is going to be spiked. So
I'm familiar with those aspects, but you're talking about what happens in healthy people.
Yeah. So I guess people. Yeah. No. So then, my question too was that when you get sick, you lose your appetite. Is that your body's natural response to saying, look, we don't want to worry about digesting food. We want to worry about healing the body. So don't eat.
Well, there are lots of reasons you'd probably not want to eat, everything from fever to nausea. And there's some reason this virus tends to shut down the ability to smell and taste.
That's
and
interesting.
So it's like eating chalk. If you eat something, it's not, any taste. So it's not too appetizing.
No, that doesn't taste good.
If people are feverish, they don't tend to eat.
That's interesting. I wonder why that does that, that you will lose your taste and your sense of smell.
Well, that's a question. There's a hypothesis out there that it might affect the olfactory nerves in the nose, and that would damage your sense of smell and taste. And apparently it comes back after the virus is gone. But that's one of the first signs that people have it.
And is this true to most people, or is it just to a few?
I don't know the numbers exactly, but it appears to be quite a common occurrence in infected people.
And in the beginning, it wasn't the case, though, was it? This was a newer symptom once we got into the time factor with this virus.
Well, I think also they were awfully busy with the respiratory aspect, and that may not, you get more information as you go along from the people who've had it. And so I don't think it was just something newly developed. It just wasn't noted at the time.
Wow, really interesting stuff. Isn't it interesting that viruses have their own little, patterns of things that they do, and they seem so intelligent. I mean, it's like, how does a little thing like that have this operation where they just attack and it's perfect, flawless, and knocks you out?
Their goal in life is to get from one host to the other, and unfortunately, we're dealing with one right now that does it quite well at the expense of the host. So viruses are fascinating in a lot of ways with what they're able to do with a very limited genome.
Well, I know that when I was in school and I studied a little bit on microbiology and pharmacology, they talked a lot about particular viruses that would go into your body, and the terminology you guys use is envelope, So I use it like they become a part of the system where your body doesn't see it or recognize it as being foreign. So it doesn't get attacked as quickly as others would be, let's say, a bacterial infection. So this virus, particular that we have dealing with COVID-19, is an envelope type virus.
It's an envelope type virus, but what that's referring to is that when the coronaviruses line up, they've made more viruses within the cell. They all line up against the cell membrane and bud out. So they take part of the cell membrane with them. And it's important characteristic of viruses that we look for. Probably the most important aspect to all of us now is the fact that because it has this fat coat around it, it's susceptible to soap. Right. So when you wash your hands, you use soap because soap will dissolve the fat, and that will inactivate the virus. Also, viruses do not like heat, so using warm water is important. And then rinsing a lot so that you wash anything that's off your hands. So that's where it's most important for people right now.
What about saunas and steam rooms and things like that? The people that ask me these questions, I'm just asking you because I have you in front of me. So. Jacuzzis, things like that, the warm showers, hot showers.
Well, it's good to keep clean. That's always good. But your biggest thing, I think, is, washing your hands frequently, as I described. And also, it's important right now to wear a mask if you go out, only because you may be infected and not know it, but then you could be infecting other people. And so that's why they're having everybody wear masks, to reduce potentially the spread either by aerosol or by sneezing onto a surface, and then you touch the surface and then touch your nose or your mouth.
What's funny, too, I was looking at your stats that you had in your report. Back in 1918, when we had that pandemic, I think over 1 million people had died.
Yeah. 20 to 40 million worldwide.
Yeah. And so that versus this pandemic, we're doing very well then. I mean, considering there was, I think, a total of less than 100,000 that passed away, right, from this so far?
Right. There are 190,000 in the world right now.
Yeah. I mean, that's sad, and it breaks my heart. But at the same time, when I compare those two together, I think because maybe we're more technologically advanced, we're quicker to get the word out to everybody that this is happening back versus 1918, where there's no really form of good communication except maybe telephone. But, this is a better controlled, I think, situation since then.
Well, yes, and also, that was during World War I.
Right.
So there were a lot of other awful things going on, but people were moving all over the place because of the troop movements. So there you had an amplification of what was happening. And we do have certainly better medical care in this day and age. Now, at that time, they did some of the same things. They closed down things and shut off people from being around each other and tried to quarantine folks, but it was more difficult during a wartime situation, certainly.
Yeah, they didn't have a lot of the protective, like mask type stuff that back then to give to everybody or make for everybody type of thing. So that kind of, at least for now, at least we have that to kind of give us some security. Now, my question to you is, like, if we were to open up Hawaii at some point, when do you think would be a good time to open up Hawaii? Because the governor is saying not till the end of May. That's one. But the government itself, the federal government, saying certain states in phase 1 can open up particular types of businesses, maybe not all, but and we're in phase 1. Hawaii seems to be in the phase 1 category from as far as the federal government's concerned. You, as an expert, as a virologist, what would you recommend we do here in Hawaii, seeing that we had such smaller numbers?
The virus will determine the timeline, okay, because of what it's doing and what's happening in the population. The best outcome, of course, certainly would be if we had much broader testing, so we actually had a better understanding of where the virus is and what it's doing. And then also we have effective quarantine and also follow up with anybody in contact with somebody who's infected. So those all need to be in place and working really well. And it has to be at least 2 weeks since the last infection. And so we're not anywhere near that, and really not many states are. In fact, I don't think any of them are.
Yeah, I think Lieutenant Josh Green was saying something like yesterday we're getting less and less positives. I think it was 2 yesterday. I don't know what today's count is, but we definitely flattened the curve, but we're not out of the game yet. We still have to be careful.
We really do, because I would emphasize that, because we flattened the curve, but we don't see an end of it yet. The virus is still there. There's still apparently a lot of susceptible folks. And so as long as it's circulating, we're going to have to continue a lot of what we're doing. Our lives have changed, clearly, as to what we can do. And I said it's really hard on people in Hawaii because we like to hug, and that's a great thing. But there are certain things we're not going to be able to do for a while. We're particularly going to have to try to protect the kapuna because they're the ones with the highest death rate. So it's not going to end anytime soon.
It's crazy to think that too, but it's true. I mean, people keep saying, we're going to get back to normal. Our normal is not going to be what was before. I think everyone's going to have a little bit of a subconscious in the back of their head. There's a virus out there. Even if it's cleared out, I think you're always forever going to be changed in the way that you touch things, the way you touch people, because you're just afraid that you might catch a disease or an illness. I mean, it's kind of psychologically got us trained to think that everything out there is viral, but at the same time too, Doctor, I think, we combat something every day. I mean, don't we do it not with the strep and the staph and the, with E. coli's out there when you're using the bathroom and things like that. You got to be careful, washing your hands. All the hygiene stuff is good, but our bodies are so resilient and so strong and able to combat everyday stuff, everyday germs. I don't want people to get a phobia. That worries me that people might develop a phobia, and that the way that we engage with each other might change. The social engagement might change because of this,
Well, it could be, but I hope not. I think people are realizing more how important the social connections are for their health and well-being. And our bodies are very resilient. I mean, they're just marvels as what we deal with, from birth on, as to what we are able to do as human beings. So, but in certain cases, microbes rule. In this case, that's what's happening, and it'll end. But there's always a danger of a pandemic, and we must be better prepared.
Yeah, I mean, structurally, yes, we need to be much more aware of things that we should do. Like, this is a good education for all of us, I think, things that we need to do. Something like this happens again. What can we control? We can control what we touch, we can control, where we go, what we breathe in, maybe to some degree, depending on where you are, the foods we eat, the things that you were talking about earlier. Our lifestyle is, got to be hygiene. You got to be careful with that too. But at the same time, you need to live your life too. I mean, I got to tell people that too. I mean, you can't be afraid of everything that's out there. This was just a good wake-up call for us, I think. Unfortunately, some people lost their lives for this, and families are changed for that as well.
Well, I'm hopeful that we'll be better prepared, and we've learned our lesson for the next one, because there will be a next one, and that's where the global cooperation and doing surveillance and doing testing immediately to try to confine these types of events. But I also like to encourage people in the fact, and I have a quote here that I love from Ralph Waldo Emerson, who said, "The sun shines after every storm. There is a solution to every problem. And the soul's highest duty is to be of good cheer."
Yes, absolutely. Yeah, he's incredible. I love Emerson. He's brilliant. His writing is brilliant. And people. I think people don't understand that's true. You wake up every day. You wake up is a blessing.
Yes.
And
I start the day by inhaling blessings and exhaling gratitude.
That's exactly what I've been talking about, people. Positive attitude. Yeah, I did a quote myself before you came on. I said, if you change the way you look at things, the things you look at will change. And it's all perception in your attitude towards the life, and everything. But I think for what you do and what you know, I wish I had your brain.
Then I wouldn't have it.
No, you wouldn't have it. I would have it. Because to know what you know at the level that you understand the microbes, because our bodies consist of more bacteria than cells, do we not?
That's true. Mm-hmm.
And so we're made up of microbes. I mean, there's a lot of bacteria. That's why we need to keep, our gut health as well. I think that makes a big difference also in dealing with viruses and infections and things like that and inflammation. Any suggestions on what else we can do to combat any type of infections that we could perceive to get? I mean, because this is going to happen again, you said. So what can we do besides our hygiene? What would you recommend as a expert?
Well, we as individuals, certainly I think we should, as a researcher myself, I think we should support research so that we know more about all of these agents that potentially cause us harm. And like you said, there are many, many good ones out there that we need, and we encounter them all the time. They aren't problematic. But we need to be attuned to what is and also cooperate globally so that we can keep the whole world healthier. You just can't keep yourself healthy. You've got to worry about your next-door neighbor and your global neighbors. I really can't emphasize that enough, that global cooperation is critical for controlling these types of unique agents that come along and cause widespread disease.
Yeah, and a lot of common sense, too.
Yeah, common, that's kind of an oxymoron.
It is.
Not always so common, but common sense is needed. And I know people are suffering right now because of job losses and all the things that have happened. And that's really harsh. We hope that this is temporarily going to help us save lives so that then we're buying time to try to get, say, a drug or to get closer to the vaccine or try to keep as many people protected as possible. And that's what we're having to do. And it's pretty critical that we do that at this time.
So do you think the biochemists of the world, the people that are trying to come up with these vaccines and these medications to help support our bodies from these viruses, I mean, this one we're trying to figure out. But the next one that comes up, I mean, can we come up with something that's a little bit more generic to the coronavirus family? Or is this something we can't predict? This is going to have to wing it again when this happens again.
Well, one of the critical factors, and I used to work a lot with influenza viruses in humans, lower mammals, and birds, and I learned a story at the World Health Organization. To see it, you have to look for it. To look for it, you have to prepare for it. If you see it, you have to prepare for it. And so that's what needs to happen, too, is international surveillance on different viruses so that we know what's circulating in different populations.
Right.
And so that we can be better prepared. Viruses have unique features. Some of them, like, COVID-19 is different from SARS, is different from MERS. So they all have certain distinct natures. But what we look for and what is likely to be found with all the research and efforts going into this is what is a unique aspect of that virus, particularly when it replicates in a human cell, that we can block and stop it. We know with vaccines we can use antibodies to help do that, but they're looking for drugs, too, that will block a certain step. And as I said, there's that one drug that was developed for another virus, totally unrelated, which may be helpful. So there are some common features, and hopefully we'll come up with one soon.
I would think a strong antioxidant form of a drug, like that would combat a high amount of inflammatory, free damaging radicals in the system, that would help support the body to be able to support the cell to fight any type of intrusion. No?
Well, it's not shown that those will particularly block a virus from.
No, maybe not the virus, but maybe it might help the body to be able to support itself enough to get rid of it.
Well, it's always good to have a healthy body. I mean, people that's the reason the older people are having more problems, because they have other diseases and conditions which make it more difficult for them, and they are more likely to succumb.
It's interesting. Even some, just a few, just very small percentage, very tiny percentage of healthy people didn't do well with this too. So that kind of made me nervous.
Right. They're learning a lot about one thing that's rather surprising is a problem with clotting in young people. And this virus has it has a large genome for a virus. So apparently it's producing in the cells something that is really causing a disruption to the clotting system. And so we need to know what that is to how to prevent that.
Man, you guys got your work cut out for you. Let me tell you, that's a lot of investigative work. Like, because right when you think you know it, something else pops up and you're like, oh, nope, maybe not that direction.
They are fascinating in one regard. Of course, most of us study them because we're also interested in keeping people and other populations in nature healthy, not to succumb to.
Well, I really appreciate you being here with us today, Doctor. And I wanted to know if people wanted to get a hold of you, maybe whether to interview you or to have you be a speaker for their organization, things like that. How can they find you? Is there like a number or website that they can contact you with?
Well, email is usually the best way. V Hinshaw, HINSHAW, at Hawaii.edu.
Okay. Perfect. And you have a Facebook, correct?
Right.
And
I'm on Facebook.
Is that your full name, Virginia Hinshaw?
On Facebook, yeah.
Yes. Okay. Well, if they need to message you or something like that, they can do that too, just in case. And then I can also, take care of you. And that says if they want to reach out to me at befitforhealth.com, they can contact me that way and I can forward the information to you as well.
Okay.
But I do want to say thank you so very much. And if we need to bring you back on, I'd like to invite you back at some point, if that's okay.
Oh, sure. I appreciate your doing this to get people good information because there's a lot of bad information out there, and sometimes it's hard to distinguish amongst that. So it's good. I appreciate you doing this for the public. Well,
I like I said, we're a team, right? Everybody has to help each other out, and I figure this is the best platform to get that out there. And there's so much news out there that's fake news, and there's people putting their theories out there, and it's confusing everybody up. So having someone like you on the show is just perfect. So thank you very, very, very much. Definitely.
Okay, take care and stay healthy.
You too. You stay healthy as well. Thank you very much.
Bye-bye.
Bye-bye. All right. So we're going to be closing up in a bit. I just want to say thank you to everybody who tuned in. This was an excellent show. The doctor gave us some really good information, and I hope that gave you guys some answers to some of the questions you may have had regarding this virus. And obviously, there's a lot of work that's ahead of us with this. But my suggestion is don't give up hope because life is worth living. And, the tomorrow is going to come and enjoy today because that's all we have right now. Until then, if you guys have any questions or comments or concerns, you guys are welcome to reach me at befitforhealth.com. Or if you want to email me, if you have any questions, it's b.befitforhealth@gmail.com. And you guys can go to my YouTube, Be Fit for Health, and, the Facebook, IG, the same thing. So thank you, everybody. I wish you all good health. Please stay positive, and definitely take care of yourselves and take care of each other. Aloha.